Today, we're jumping into a massive global showdown. It's a story that pits two huge ideas against each other: our fundamental right to health versus the right to make a profit. It's all about how one country became the world's pharmacy and how a single line in its law book completely rattled the multi-billion-dollar pharmaceutical industry.
I mean, just think about that for a second. What if you were diagnosed with something and the cure came with a price tag so high it was basically a death sentence unless you were incredibly wealthy? It sounds like something out of a dystopian movie, right? Well, for millions of people, that wasn't a movie. It was the terrifying reality of the global AIDS crisis back in the late 90s and early 2000s. And the country that decided to step up and rewrite the rules, that was India. Okay, let's just let this number sink in. $12,000. That was the price for the cocktail of drugs needed to keep one person with HIV alive for 1 year. For almost anyone in the developing world, especially in Africa where the crisis was exploding, this number was just impossible. It wasn't just the disease killing people, it was the price tag on the cure.
So, with the world staring down this public health catastrophe, a solution started to emerge from a pretty unexpected place. See, before global patent rules were super strict, India's drug industry had gotten really good at reverse engineering patented medicines and then producing them for a tiny fraction of the cost. And this chart, wow, it just says it all. By the mid-2000s, look at that, Indian generic companies were supplying over 80% of all the donor-funded AIDS drugs going to poorer countries. They weren't just a part of the market, they were the market. They had literally become the pharmacy of the world.
But this lifeline, this incredible source of hope for millions, was under serious threat. A whole new global system was being put in place that was about to change everything and force a massive confrontation between India's model and the world of intellectual property.
So here's how it all went down. Back in 1995, the World Trade Organization creates this thing called the TRIPS Agreement. Basically, it forced all member countries, including India, to start recognizing patents on medicines. Now, after a lot of pushback, the Doha Declaration in 2001 made it clear that, okay, countries could use flexibilities to protect public health. But the clock was ticking. The hard deadline for India to get with the program was January 1st, 2005.
And the stakes here were just astronomical. If India adopted the same kind of patent laws you see in the US or Europe, that pipeline of affordable generic drugs keeping millions of people alive could just dry up. The world's pharmacy was facing a choice: comply and risk a global health disaster, or find another way.
Well, India chose another way. When it finally changed its patent law to comply with TRIPS, it slipped in a very specific, very clever, and yes, very controversial clause. It was designed to be a legal shield to keep the pharmacy's doors open. All right, this is it. This is the legal text that started the whole firestorm. Section 3D of the Indian Patents Act. I know it looks like a bunch of dense legal jargon, but this short paragraph became the central battleground in the global war for access to medicine. So what does it all mean? Well, the key part is this idea of enhanced efficacy. Section 3D basically set a really high bar for what could be called a new invention. It said you couldn't just take an old drug, tweak it a little, and get a brand new 20-year patent. You had to prove your new version was actually better at treating people. It had to be a better medicine, not just a slightly different one. And make no mistake, this was a direct shot at a practice called evergreening. That's the game where drug companies extend their monopolies for decades by making tiny, insignificant changes to existing drugs that offer no real new benefit to patients. Section 3D was built to stop that dead in its tracks. And you just knew a challenge was coming, right? It didn't take long for this new law to get put to the ultimate test. The Swiss pharma giant Novartis had a new version of its blockbuster cancer drug, and they wanted it patented in India. This set the stage for one of the biggest legal showdowns in the history of public health.
So the argument really boiled down to this. On one side, you had Novartis saying, hey, our new version of this drug is a different chemical form, it's a legitimate invention, and it deserves a patent. But on the other side, the Indian Patent Office said, not so fast. You haven't proven it has enhanced efficacy, that it's any better at fighting cancer. So under our law, Section 3D, it's not patentable.
And this wasn't a quick fight. Oh no, this legal battle raged for years. First, the Patent Office said no. Then, Novartis didn't just appeal, they sued the Indian government, claiming Section 3D itself was illegal. The whole thing worked its way up through the courts until it finally landed at the Indian Supreme Court for a final, landmark ruling. And then, in 2013, the verdict came down. In a unanimous decision, the Supreme Court upheld the patent rejection and confirmed that Section 3D was perfectly legal. It was a massive, massive victory for public health advocates and for India's right to define what a true medical invention is.
And this quote from an earlier High Court ruling in the same case just perfectly nails the entire philosophy. The court literally weighed the commercial interests of a company against the public's need for life-saving medicine and decided that public health comes first.
So, you might think, okay, huge victory, battle's won, right? Well, not exactly. This was just one major battle in a much, much longer war. The pressure on countries like India to weaken these kinds of health protections has only gotten more intense since then.
Because the threats just keep coming, and they keep changing shape. You've got these TRIPS Plus rules being pushed in trade deals, which are even tougher than what the WTO requires. We've seen generic drugs from India, on their way to Africa, literally get seized in Europe. And there's just this constant, intense political pressure on any country that dares to put public health before patents.
And you don't have to look far to see this in action. I mean, think about the COVID-19 pandemic. Countries that tried to use those very flexibilities from the Doha Declaration found out the process was incredibly slow, complicated, and just plain difficult. It really showed that even when the rules are technically on your side, actually using them is a whole other battle.
So at the end of the day, we're still grappling with this huge fundamental tension. How do we, as a global community, reward the incredible cost and effort it takes to discover new drugs, while also making sure those discoveries don't stay locked away from the very people who need them to survive?
The story of Section 3D is the story of one country's very bold answer to that question. But as new medicines for everything from cancer to future pandemics keep coming, it's a question the entire world has to keep asking. Who gets to decide?